multiple choice. Yep, and if you could feel free to fill that out.
Nat, see if you can launch it. Nat, are you able to launch the poll? I can't.
It's launched.
Oh.
People are answering right now. What perspective do you bring today? So we have almost 74% people. We have a lot of service providers. We have educators, healthcare workers, advocates. So far, not anyone from research or employer HR, but yeah, a lot of advocates and service providers, health workers and educators. So welcome everyone. And we're really, really glad to have you here with us today. Yeah, so if we want to move on to exactly what is the New Jersey Paid Leave Outreach Collaborative. So the collaborative works to increase workers and employers' awareness and understanding of paid leave in New Jersey so that all workers can access paid time off when they need it the most. So we do this by bringing together a wide range of organizations committed to the goal of increasing awareness, understanding, and usage of paid leave. And we hold quarterly virtual convenings like this one. So you could actually visit our website and stay tuned for new content and more opportunities to get involved, which I will drop in the chat. Great. So as a reflection of the poll, I'm going to share the results. And yeah, this is most of the perspectives we have here today. We got a lot of people from service providers, advocates, and then a couple of educator, healthcare workers, and researchers. So really glad to have everyone here today and to be bringing in all of these perspectives. All right, so also, before we move on, I wanted to acknowledge that, all of the perspectives and identities within that poll often intersect, and we want to honor that and verbally acknowledge that. And I'm actually really happy now to introduce Peg Kinsell, who is the policy director at SPAN Parent Advocacy Network, and Dr. Josie Badger, who is president of J. Badger Consulting and the Raise Center director of SPAN Advocacy Network.
Thanks, Nat. I will take it first. Good morning, everyone. I'm so glad that you can join us we're real excited about this convening, especially because of the work that SPAN does. As Nat said, I'm the policy director there and also director of military family support project, but focused on children with disabilities and special health care needs. Our Parent Training Information Center is the support, technical assistant and training center under the Individuals with Disabilities Education Act. And we also house New Jersey's Family Voices and the Family to Family Children Health Care Center. So we have a vested interest in this work and have for a long time. I'm proud that SPAN's been a part of the Time to Care Coalition. 15 years plus now. 15 years ago was when the first legislation was signed. And then through a lot of advocacy, improvements were made and re-signed in 2000, maybe 4 years ago. I think it was 2019, the start of 2019. And I think that's what the crux of my conversation is with you today, is how important it is for the disability community part of this conversations and this advocacy. We even through the advocacy to first get the bill passed and then the improvements, we were able to double the time of the paid family leave insurance, increase the benefits, increase intermittent leave, which is a lot of times really crucial to the families, our own families and the families we advocate for, improved anti-retaliation, and expanded the individuals that were eligible to take paid family leave, because we know, especially today, not every family looks the same, and that family and caregivers needed to have a broader description. One of the really important things too, again, that we sometimes minimize with folks with disabilities was the inclusion of domestic and sexual violence in allowances under paid family leave. So I have 3 minutes. I can't do a whole broad education, but those are some of the things that real advocacy, grassroots advocacy make happen. And I want to make sure that the disability voice is included in those conversations. And why do I think we're important? Because, you know, my own familial experiences, the families and youth that we advocate for, and certainly a majority of our staff also are families of individuals with disabilities or special health care needs. And in New Jersey, that amounts to about 1 in 4 adults. I have the CDC number that says right now 1,633,748 adults in New Jersey have a disability. That's 1 in 4, or 25%. For our work, we focus mostly on children and youth, and those numbers aren't much better. 1 in 5 children in the United States has a special health care need. That's approximately 14 million kids. More than 1 in 4 households with children have at least one child or youth with a special health care need. Special ed students make up roughly 12% of students in New Jersey. I'm sure you've heard how autism is on the rise nationally, and here in New Jersey, those rates are 1 in 35. And recent numbers from the CDC, like a couple of days ago, is that the number of American children that have been diagnosed with developmental disabilities has increased. So I say this and throw these numbers out at you, not to hope that you remember the numbers, but to understand the impact of the inclusion of people with disabilities and special health care needs in our society, in our families, with our colleagues, in our workplaces, and why this work is so critical, and why I truly believe that authentic voices of people with disabilities and their family members have to be at this table. We should be an integral part of this advocacy. And so my pitch is to look to the collaborative and what we're doing and the ways we're trying to improve paid family leave, and lend your voice. On that note, I'm going to introduce my colleague, Josie Badger. Josie, we're lucky enough that works with us and directs our RAISE, which is our national transition project. I'll let her talk about. But she's also a national advocate and the president of her own consulting business. So Josie, thanks for joining us.
Thanks, Peg, and hello, everyone. Good morning. I am a white woman. I am going to call myself early middle age, even though I'm kind of middle. And I have medium brown hair down to my chin. So I'm excited to be here with you all today. I am actually from Western Pennsylvania, and we do not have paid leave. And so I covet your paid leave because I see how important it is. And I have been working on getting our paid leave, which is called the Family Care Act, passed for the past 3 years. And so I came into this work both as a woman with a disability who's had a disability since birth, as an advocate, professional, and a business owner. And so I want to take you back very quickly to highlight what brought me into this field, but then we'll break it down on why it's important to us now for the overall disability perspective. So I had my disability since birth. I was in the hospital my first full year of life, and then on and off really until the age of 7. Every time that I would go into the hospital, I would be in like the step down ICU unit. And every time that I went, I ran into this little girl. She was 2 or 3, named Rayanne. Rayanne had some transplants, and she also received too much medication after her transplants, which ruined other organs. And so they sent Rayanne to Children's in Pittsburgh to get care for her transplant. Pittsburgh's known for that work. And every time I went, Rayanne was alone because her family couldn't leave their jobs because the jobs provided the insurance. They allowed Rayanne to stay alive, but they also worked out of New Jersey. This was before your paid leave. And so I can't imagine what her life would look like now, differently, having family with her all the time. That's what led me into this. But now, as a woman with a disability, Peg just mentioned the kids with disabilities in Jersey, and there's approximately 61 million Americans with disabilities. And as we get older, we're more likely to have disabilities. For me, it means being able to take time off for surgeries like I'm having tomorrow. It's about making sure that somebody can care for me when I come home. And at this point, we don't have that. And so your work and your commitment to these efforts are vital. What's vital for us as people with disabilities is knowing that we can take the time off to get the care we need, to be able to return to work, because I believe that every person who wants to work should have the right and ability to work. And part of that effort is through paid leave. So thank you guys. Keep up the good work. And just remember people like Rayanne and why this would have changed her life. So I think I'm turning it over to Yara for a video.
In the US, millions of workers don't have paid leave. This is one family story. In the US, millions of workers don't have paid leave. This is one family story.
Stephanie is on the autism spectrum. She has multiple medical conditions. Despite all of that, she is a cheerful, outgoing person. She writes a daily newspaper. It's a fairly short newspaper, but by golly, it includes the day's headlines, the weather, and the celebrity birthday of the day. And she makes sure we read it. She's a very aggressive salesperson.
My name is Lauren, and I live in Mercerville, New Jersey. Like most expectant mothers, I thought I would have a typical maternity leave and go right back to work. But unfortunately, Stephanie was born with a serious kidney disease and her kidney function was only 15%. I fortunately had accumulated all of my sick, personal, and vacation time and was able to use that when she was first born because she needed to stay home longer and I couldn't go back to work right away. After 6 months, I was able to go back to work with the doctor's blessing, and he said we could do partial daycare. Unfortunately, Stephanie was sick most of that time, and I needed to take a second leave. We were fortunate that the Family Medical Leave Act, which was the federal law, had just gone into effect. The unfortunate part about that was that it was unpaid leave. So despite the fact that we had no debts, we had no credit cards, student loans, car loans, any of that, we went $20,000 in debt. We almost lost our home. I didn't want other families to go through the same thing. We were able to fight for family leave insurance, which is paid family leave.
Lauren advocated for paid leave. New Jersey now is one of a growing number of states to guarantee paid family and medical leave.
We knew since birth that Stephanie would need a kidney transplant. She lasted until age 19 before that became a reality. By that time, New Jersey had paid family leave, and we were able to utilize that. The hardest day was in the morning. The transplant team met me in the hallway and said, come into the conference room. And I already knew her new kidney was rejecting. Both my husband and I were able to take paid time off and help Steph through her recovery after her transplant.
I think it helped her survive. I think if we hadn't been there for her, she would have had a rougher time than she did.
Only 1 in 7 workers has access to paid leave to care for a family member.
She plays music. We sometimes play Heart and Soul together on the piano.
She is a poet and a writer.
I woke up one morning to see my mother so dear. To my surprise, I was in a happy-go-lucky cheer.
She has a future. She is looking forward to the future. She's an optimistic and cheerful person.
Because of paid family leave, we knew we didn't have to worry financially. We didn't have that burden. We knew we'd keep our home and that everything would be okay.
Join the fight for paid leave. Visit thearc.org/paid leave.
Awesome. Thank you so much, Lauren, Josie, and Peg, for sharing your experiences and perspectives. And we really appreciate you being here. And while Lauren was not able to be here today with us, her work on paid leave and for the disability community is quite well known. So we just want to thank her in particular and wish her the best. Now I'd like to introduce Rebecca Glynn, who is a representative from the New Jersey Department of Labor.
Good morning, everyone, and thank you, Peg and Josie, for just setting the context and your storytelling and that important data. It's incredibly motivating, so I'm just so excited to be here today to share with you some information on paid leave in New Jersey specifically. Hopefully you can all see my screen. This is going to be a super high level overview. I'm going to go through it kind of quickly. I don't have a ton of time, but just know that you will get these slides as well as my contact information after the presentation. So if you miss something, no worries. You will get it after that. Feel free to put questions in the chat. There's going to be a few minutes at the end for Q&A, and then if we don't get to something, we'll either follow up in an email or try to answer it in the chat as the event goes on. I'm also really lucky to have some of my colleagues from the New Jersey Department of Labor with me here today who can help me answer any questions that stump me that you asked. So thank you guys for being here. Really excited about it. Okay, I'm going to go right into the presentation with a quick disclaimer that this isn't any legal information and this isn't an official source of information. The only official source is the New Jersey Register and Administrative Code, but we think we do a pretty good job of keeping these slides updated and accurate, so we think you can trust this. Okay, so first we're going to talk about what we call New Jersey paid family and medical leave. And when we say that, we mean temporary disability insurance, and family leave insurance. These are cash benefit programs that the New Jersey Department of Labor administers. In addition to these cash benefits, your job could be protected under state and federal law, which is not administered or overseen by the New Jersey Department of Labor, but we will share some very brief information of that and where you can learn more. So New Jersey Temporary Disability Insurance, or Family Leave Insurance, you might hear me use the acronyms TDI and FLI, though I try my best not to. They're cash benefit programs when you have to stop working to care for yourself or to care for a loved one. You can receive 85% of your average weekly wage up to a weekly maximum, which changes every year. In 2023, that's $1,025 per week, which is the maximum. Just know that eligibility is, there's a few different requirements, but know that most New Jersey workers are covered under this law. There's very few exemptions. There are earnings requirements, which are relatively low, and you have to work for a covered employer. This is not based on employer size or anything like that. Like I said, there's very few exemptions. I won't go into the details about eligibility, but our website has a lot more information for you to poke around at. So first, I'll talk about temporary disability insurance. This is if you can't work to care for your own physical or mental health condition. You can also use temporary disability insurance if you are pregnant or recovering from childbirth. In general, you can receive up to 26 weeks of benefits for temporary disability insurance as certified by a medical professional. So the doctor is who certifies how long you might need leave for. If you need longer term benefits, there is Social Security disability insurance. The Department of Labor administers the benefits, but we don't oversee the program. So the Social Security Administration's website is the best source of information on that program. Next is family leave insurance, and this is if you can't work to care for your loved one. And the definition of loved one is very broad in New Jersey. It's not just your immediate family. This also includes any biological family, any family related by marriage, or anyone you consider to be family, including chosen family. You can also receive family leave insurance to cope with domestic or sexual violence, or to care for a loved one who is a victim or survivor. And then finally, you can use family leave insurance if you're bonding with a newborn, newly adopted, or newly placed foster child. For family leave insurance, you could receive up to 12 weeks of benefits if you take it all in a row or consecutively. If you're not taking it all at once, you could take it a few days or weeks at a time, depending on the medical need. And if you do that, it's considered intermittent leave, and you could receive 56 weeks or up to 8 weeks of benefits. I'm going to briefly go over some tips on applying when you're ready to apply. We recommend applying online. It helps you avoid mistakes in the application and accidentally skipping questions. However, you could print and mail or fax in an application. The only exception is that for claims, if you are a victim or survivor of domestic or sexual violence, right now you do have to apply on paper, and we have more information on our webpage dedicated to victims and survivors. A trusted person can help you apply, and for temporary disability insurance, you can list a representative who can call in and get information on your behalf. Note that it takes 2 to 6 weeks to approve a claim and pay benefits once we have all the information we need to assess your claim. So it's important to do the best you can to plan for that. And to that end, it's really important that you follow up with your medical provider. So the medical provider is who certifies either your need for leave because you have the health condition, or because the patient that you're caring for has a health condition. So it's really important that they fill out their portion quickly, or else that can hold up evaluating your claim. And also it's important that the information they put matches your application, or you might have to follow up with additional questions. And here's some other web pages listed here for additional information on how you get your benefits and how you can contact us. Because caring for someone with a disability so often happens on an intermittent basis and not on just all at once, we have some additional information on applying for intermittent leave. So you can either select on the application up front that you're going to take intermittent leave, but as soon as you don't take the full 12 weeks, you could potentially be potentially be eligible for, it becomes what's known as an intermittent claim. And at that point, we'll automatically send you a form that you could fill out when you take additional days of leave. And if you lose that form, what you could do is fill out Part D of the paper application as well. I have the form names on the web listed here. If you need to take additional leave because of a change of prognosis, your medical provider might need to provide additional information. After 1 year from the start of a caregiving claim, you would need to file again. You just have to start all over. You wouldn't keep filing for intermittent days after 1 year. I know that this text is really small, but just note this orange box at the bottom of the screen is where Part D is and says partial leave schedule. That's where you would fill out any additional intermittent days of leave you took. Like I said earlier, what I was just talking about was our cash benefit programs that the New Jersey Department of Labor administers. They don't necessarily provide job protection, but your job could be protected under state and federal law, which are listed here. In general, eligibility for these laws are based on employer size and how long you work there, not on earnings. So you might be eligible for cash benefits, but not job protection and vice versa. Of course, it works the best when you can take them all together. And our webpage on job protection, which is listed at the bottom, has some more information for you. And again, we will share these slides with you so you'll have access to all those links. While our programs don't provide job protection, there is anti-retaliation wording. If an employer retaliates against you for taking or seeking to take leave, you have the right to take private legal action. And if you need help with your claim, here's some information. Just a note, with our customer service line, we are constantly adding new call center agents who are ready to answer your calls. We recommend calling at this point Wednesday and Friday morning when call volume is lowest, but of course we are there answering the calls Monday through Friday. I don't have a ton of time to talk about New Jersey earned sick leave, so I have some information in the slides that I'm going to just skip over that you'll get in the follow-up. But what you really need to know about this is that sick time is the law in New Jersey. Nearly all employers of all sizes have to provide sick time to their employees, and employees accrue this for 1 hour of every 40 hours worked. This applies to employees who are full-time, part-time, seasonal, temporary, no matter how they're paid. This is really an expansive law. And we have a lot more information on our webpage, mysickdays.nj.gov. And you can receive sick time for a variety of reasons, including to care for your own or a loved one's physical or mental illness or wellness care, to get the COVID vaccine or any vaccine and recover from side effects, to cope with domestic or sexual violence, or to attend a meeting at your child's school. Just going to skip through these slides because we don't have a ton of time. But if you feel that your employer is violating your right to take sick time, you could file what's called a wage complaint for free at the New Jersey Department of Labor website. And we have some information of that, how to do that here on our My Work Rights page. Yeah, I'm going to open it up to questions right now, but I'll just say that we have some additional resources beyond the Department of Labor at myleavebenefits.nj.gov/more-help. This will connect you with resources across different state agencies in New Jersey. I also wanted to mention that it is against the law for your employer to discriminate against you for your actual or perceived characteristics. There's a list of them. And one of those is having a disability, and NewJerseyCivilRights.gov is our colleague's website where you can find more information. I think I saw someone from Civil Rights on the call today, so thanks. You can correct me if I give any misinformation. And this is my email address. You're always welcome to follow up with me, even if it goes beyond the Department of Labor's resources. I would always be happy to help connect you with the right person. So yeah, that's it.
Yeah, thank you so much, Rebecca, for that training. And we actually don't have time for Q&A.
Okay.
I do encourage anyone to ask any questions in the chat, and we will, Rebecca and the Department of Labor will get back to you. If not in the chat, then via email. So thank you so much, Rebecca. It's always lovely having you on our calls. And now I'd like to introduce Paulette Eberly, who is the co-chair board of New Jersey Citizen Action and disability and civil rights advocate and resident of Jersey City. I think Paulette was in and out of the call, so let me actually see if she's with us. Yes, I see you.
Hello, this is Paulette, I think.
Hey.
Okay, I'm having a lot of trouble. So I'm going to try to be brief and I'm going to try to stay with you, but bear with me. I got to hear a lot of what everybody was saying, and it's nice to have people with disabilities included as we were in passing this very important legislation. For people with disabilities, there is another aspect to paid family leave, in that although we are 20% of the population of this country, we have a 75% unemployment rate. So for a person with a disability who has managed to be hired for a job, keeping that job can be a problem. And it's often overlooked, even by our legislators, that we have, as people with disabilities, full and complete lives. We have children, we have parents and family members who may need our help. And I was in that position, although not employed at the time, that I had to take care of two of my dying parents. But the assumption seems to be that we are the people who must be taken care of. And quite the contrary, we are people that are excellent employees. We have full and complete lives. And this piece of legislation has made it possible for the person with a disability who is employed to even have a larger participation in life. Once we get those jobs that we have struggled for, a lot of the time it's impossible to keep them and do what we have to do. But this legislation has given us the opportunity to stay home with our children, whether we have adopted or we have given birth to these children. If we do have a family member who needs our help, then we have that opportunity to care for them the way we want to and the way every other person is able to. So this legislation has really enhanced the lives of people with disabilities. And other people have spoken before me about how important it is for a child with a disability, an adult with a disability, for the people that may have to care for them to be available. All of these things come together, and it's very important, and it did happen that the disability community participated fully in the passing of this legislation. So I would really like to keep the ball rolling there. And I realize I'm preaching to the choir, but this was an important aspect to passing this legislation, was that we came together and we all worked together from our various organizations. And the truth of this is that every issue that involves every person in this country is an issue for people with disabilities. Sometimes it's forgotten that we are a part of this community as a whole, and we bring something to it. So this was magnificent when we were working on this legislation that took 12 years to pass, that we had such an active part in it. And I hope we continue in that vein. There's many more conversations for the future to have. One of the things I would like to be talking about is, well, why do we have a 75% unemployment rate? But that's for another day. But they do go hand in hand.
Great. Thank you so much, Paulette. And now we want to actually introduce Javier Robles, who is the faculty member and professor of the Kinesiology and Health Department and co-chair of the Rutgers University Disability Studies Committee. And thank you so much again, Paulette, for just being here and for, sharing those, that, personal story and those stats.
Great, thank you so much. Let me just share my screen really quick. Hopefully everybody can see that. Good morning, everybody. I think this is a great month to celebrate the Americans with Disabilities Act, which was passed in 1990 and amended in 2008. So I'm just going to do a brief overview of the Americans with Disabilities Act for you all. I know we're sort of short on time here. So the ADA is a civil rights law that prohibits discrimination against individuals with disabilities in all areas of public life, which include schools, transportation, jobs, as well as public and private places, which are open to the general public. It's intended to ensure that people with disabilities have the same opportunities as others. It's divided into 5 titles, which relate to different areas of public life. And the ADA defines disability as a physical or mental impairment that substantially limits a major life activity, a record of such an impairment, or being regarded as having such an impairment. So any one of those, not necessarily all of those put together, okay? Go through the titles real quick. Get my computer to cooperate. Okay. So Title I, which is employment, which is, I guess, today's main topic in terms of what we're talking about, applies to employers with 15 or more employees, that's private employers, requires them to provide reasonable accommodations to someone who has a disability and is requesting this accommodation basically to do the functions of their jobs because of their disability. And it should be provided unless this accommodation would be what's called an undue hardship to an employer. Undue hardship really is a case-by-case basis. If you're Microsoft, you're going to have a hard case proving that you're going to have an undue hardship, whereas if you're a small employer, you may have a better case that something could be an undue hardship. The Title II is public services, which is state and local government, and it prohibits state and local governments from discriminating against individuals with disabilities. They are considered public entities, and it requires that they make their programs, services, and activities accessible to individuals with disabilities. And when we're talking about state and local government, we're not just talking about the state of New Jersey or the township of Edison. We're talking about, universities. We're talking about a lot of different players. So think about state and local government broadly. Public accommodations, which is, any business that's open to the public that's either privately owned or owned, publicly, it's a public accommodation. There's standards for public accommodations called the ADAGs, which talk about the physical accessibility. And there's also programmatic accommodations, which are called reasonable modifications for businesses in terms of the way that they deal with the public. As an example would be, if I go to Macy's on Christmas and I ask for an assistant to help me around the store because I am, in a wheelchair, they would provide that accommodation to me. However, if the average person came into Macy's and made the same request, that's what's considered a personal shopper, and they would charge you a lot of money per hour to do that for you. So, that's a public accommodation in a place like Macy's. The telecommunications portion is Title IV, and basically it just talks about how phone companies or internet companies should and must provide services to individuals that may have hearing or speech disabilities, either communicating on the phone or watching television or other media. And then there's a miscellaneous provision, which is basically where they just put laws and other state-to-state things which could not fit in the other things. And lastly, and real briefly, transportation, which many of us struggle with. Probably one of the biggest reasons why people may lose a job is because transportation doesn't work for them. And that's covered by either Title II of the ADA, if it's a New Jersey Transit, which is a public transportation provider, or Title III, which is a private transportation provider, like let's say Greyhound or airport shuttles or anything like that. So that's a very brief overview. I apologize for the succinctity of this, but
You're all good, and thank you so much, Javier, for that overview and celebration of the 33rd anniversary of the Americans with Disabilities Act. And yeah, I know we were short on time, but I really appreciate that presentation, and it was super helpful. So yeah, we are going to move on to, which I'm really excited for, our panel section. And Mercedes Witowsky, who is the Executive Director of New Jersey Council on Developmental Disabilities, sorry, my words are not working today, will be leading that panel. So I'm excited to introduce Mercedes.
Thank you, Nat. Appreciate that. I really appreciate the opportunity to join today. I want to thank New Jersey Citizen Action and the Time for Care Coalition for this invitation, and congratulate you on the important work that you're doing in the area of paid medical and family leave. We have a very impressive panel, but I'll just give you a little bit of information about the New Jersey Council on Developmental Disabilities. I've been the executive director for the past 5 years, and the council is established by state and federal law to ensure that people with disabilities and their families and caregivers are getting the services and supports that they need. I'm recognizing that people with disabilities and their families really know best in what they need and the types of services and supports to help them live as independently and actively as participants in their communities. So through advocacy, capacity building, and systems change, the council really engages with the public to form what our goals and objectives will be like over a 5-year period. We do meet at public meetings 4 times a year, and throughout the rest of the year, many groups, the subcommittees and committees of the council, as well as youth groups, adult self-advocates, and family members meet in a multitude of ways. So if you have any interest in learning more about the council, in a little bit, I'll put the link to our website in the chat. And then I also wanted to share with you the important work that the council committed to in approaching the legislature in 2019 to form a bipartisan legislative disability caucus in New Jersey. This caucus became active during the pandemic, which most things shut down during the pandemic, but this was really energizing to bring together our legislature around disability issues, because we all know that COVID-19 impacted our disability community in many areas far worse than general population. So the caucus is very strong and committed to its work. We have over 35 legislative members who've joined the caucus. And we do have a session coming up a week from today with our caucus co-chair, Assemblywoman Ora Dunn, who'll take the lead on issues impacting early childhood intervention and the access to youth services. And then Senator Ruiz will take a close look in October's session on youth transitioning from school to the adult system. You can always watch recordings. Senator Bucco and Assemblyman Greenwald, who were the other co-chairs, led us in important discussions earlier this year on housing and access to healthcare. So I'll encourage you to take a look, subscribe to learn more about caucus activities, and always have an opportunity to share your thoughts, your concerns, so that, as we move forward in next year's caucus agenda setting, that we can take these considerations and bring them to our leaders. So that was my infomercial, I guess. So I'll now really move back on track to our topic today, and really excited that we have a very strong and committed group of panelists: Javier Robles, Dr. Deborah Spitalnik, Janet Haag, Aaliyah Lopez, Mary Saccone, and Donald Campbell. We're going to, in order to stay on track, we're going to ask them to introduce themselves and a little bit about their organization. We're going to go in that order, and we're going to start with Javier. For the first question for this panel, we'd like you to, again, introduce yourself, a little bit about your organization, and let us know what you see as the value in paid leave from your perspective, your community, and the clients that you work with. So Javier, you're going to kick us off. Thank you.
Great. Thank you, Mercedes. And I want to congratulate you for all the work you've done on the Disability Caucus, which New Jersey is only, I think, one of a very small amount of states that actually has a Disability Caucus. So thank you for that. So my name is Javier Robles. I am the president of the Latino Action Network. I'm also a Rutgers faculty and professor, and I'm also chair of the New Jersey Disability Action Committee, which did a lot of work around COVID and people with disabilities, with a number of people actually here today. So the importance of any benefit, especially this benefit, really can't be understated. I think for me, it's been important because my wife works in a school system, and it's difficult for people to get off of work, and she was able to get off of work, because of this program, and go with me when I went to training to get my service dog, Delbert, from Canine Companions. And, she was able to stay out 2 weeks. Otherwise I wouldn't be able to do that. And for people with disabilities, it's important to have a way to have a family member, someone, that can take off, not just for things like, training, but also for medical reasons. Maybe, someone even has to stay home, for quadriplegics and other people, who are in wheelchairs a lot. Pressure sores could be an issue. And it may be that someone has a pressure sore from, just sitting the wrong way or sitting down too long, and may have to actually take off a week or sometimes more just to treat that specific sore. The other important thing to think about, and this is a issue that's been ongoing and continues to be a problem, is that there is a serious lack of personal care assistance across New Jersey and nationally. So people like myself and people with disabilities across the nation are depending more and more on family caregivers. So this law is super important as we meet that particular issue, hopefully sooner rather than later. So it's, in my estimation, super important.
Thanks, Javier. Dr. Spitalnik.
Good morning. I'm so grateful to be here. I'm also, I'm feeling grateful and old, having had the privilege of being at the signing of the ADA, and how much both that civil rights protections and the ones that we're talking about this morning really complement and get us closer to our shared vision of everyone having a full life in the community. The Boggs Center is part of Rutgers Robert Wood Johnson Medical School. We are federally designated as a university center for excellence in terms of education, research and service, leadership education and neurodevelopmental disabilities, and do a lot of work with the state, with state agencies, DDD, the Department of Children and Families, and the Department of Education. So our role under the DD Act and the council, and you'll hear from Disability Rights, are really sister programs. Our part of the world is spreading information, educating the next generation of professionals, direct support providers, and perhaps most importantly, people with disabilities and families through Partners in Policy, making a program supported by the DD Council. So I think, so that's kind of our corner of the world. Personally, I've been a beneficiary of being able to take family medical leave and paid leave to care for a daughter who developed chronic disabilities and conditions in adulthood. And it's made a critical difference in my own life. And it really gets us closer, I think, our understanding of the universality of our collective human needs for support, and that we're really all entitled to be supported and to be able to fully participate. So thanks again for being here, and I look forward to discussing some of the challenges faced by the families and individuals and caregivers that we work with. Thanks.
Thank you, Dr. Spitalnik. And we're going to loop it back around to the panel, so you'll hear more from them. But next up, I'd like to ask Janet to introduce herself and talk about the significance of paid family leave.
Hi, I'm Janet Haig, and I'm the executive director with NAMI Mercer in Hamilton, New Jersey. And I wanted to just, to speak to the fact that paid medical leave is really valuable, both to the folks who are part of our community from the perspective of coping with their own mental health challenges, but also for their family members, because very, very often when someone has a mental health crisis, there is an immediate need for intervention, and for families to be able to have the flexibility to get off work, to be able to go help someone, let's say, get into a hospitalization program, or maybe it's a rehab center of some sort, and sometimes they have to travel out of state, et cetera. So the importance of paid leave for those families is very, very critical, because they're already oftentimes financially strapped trying to deal with the high cost of treatment and all of that. And so having that flexibility is just really key. So from that perspective, I think we are greatly appreciative of what has happened in New Jersey around this particular topic. It certainly makes a big difference for our community. I also wanted to thank you for inviting me to be part of this today, and I'm very eager to hear what everyone has to say about this topic.
Thank you, Janet. Aaliyah, welcome, and happy to have you on the panel as well.
Hi, thank you. Good morning, everyone. Thank you so much for having me. My name is Aaliyah Lopez. I'm a project manager and trainer at Garden State Equality, which is the leading nonprofit LGBTQ advocacy organization in the state of New Jersey. Our services include advocacy, policy work, and cultural competency trainings. We work to address safe environments for youth, improvement of health services that meet LGBTQ community needs, and respectful treatment of seniors. The work that I do specifically revolves around vulnerable populations, so such as people living with HIV, sex workers, and houseless individuals. So Garden State Equality sees the importance and value of paid leave for the community we serve, because many of them would benefit greatly from paid leave policies within their workplace. A lot of LGBTQ people need to take paid leave for gender-affirming care and/or surgeries, family planning, medical reasons, and so much more. LGBTQ people of color especially face unique barriers when accessing time off from work, whether if it's to care for themselves or a loved one. and are more likely to find themselves in job positions and financial situations where they're unable to take time off from work. Some LGBTQ people of color are forced to quit their jobs, while others are eligible to take unpaid leave under the Family and Medical Leave Act, which I know someone was talking about earlier. Some cannot afford to take off without pay. And even those who do have access to paid leave may feel less comfortable requesting it in light of anti-LGBTQ rhetoric and/or racially motivated employment discrimination. So we truly feel that the enactment of LGBTQ inclusive paid leave policies would also benefit people living with HIV and their caregivers in real and meaningful ways. They would help provide a level of economic stability for people living with HIV and enable those who care for them to aid and help out without having to sacrifice their workplace security. People living with HIV, either symptomatic or asymptomatic, are protected by the ADA, the Americans with Disabilities Act, which is why I felt it was important to represent them in this discussion, as they sometimes tend to be forgotten in conversations surrounding disabilities. So that's kind of the perspective and angle that I'm going to be bringing today.
Thank you, Aaliyah. You bring excellent perspective to this panel and this discussion. Next up is panelist Mary Saccone. Mary.
Hi, my name is Mary Saccone. I am the Director of Policy with Disability Rights New Jersey. Disability Rights New Jersey is the state designated protection and advocacy system for New Jersey. We are a nonprofit, and we basically, what that means by being the state designated protection and advocacy system is we are one of about 54, one in each state, and there are some in the territories that basically provide protection and advocacy for people with disabilities. Under the protection piece, we have authority to go into institutions or facilities where any person with a disability is at any time. So whether it be their employment or their psychiatric hospital or a nursing home, any type of facility, we can go in to see if a person with a disability is being subject to abuse and neglect. We also have the right to check to monitor those facilities to make sure that people are not subject to abuse and neglect. It's a very broad authority. So we have that abuse and protection piece of our work. We also have the advocacy piece of our work, which is we provide legal advocacy for people with disabilities to ensure that their rights are protected. So what does that mean? Rights, that's basically any issue with respect to disability rights. So we could discrimination, community services, community supports, to ensure that people have inclusion into the community. We also do things with children's services, such as special education and other housing to make sure that people obtain the proper accommodations so they can live in the community. One of our areas is employment discrimination that we provide assistance with. With respect to employment discrimination, this we've seen over the years, and since I've been there for 25 years, I've seen how people with disabilities have a hard time not only getting a job, they are employed at much lower rates than people without disabilities. But even once they get a job, they sometimes have experienced problems in terms of they need to take time off for medical appointments, for just because of their condition. And sometimes they don't know when that's going to be. Sometimes it just pops up. Their condition is intermittent, so that they may just be unable to take time off. And they're worried about they're losing their job. And they make less money. They tend to make less money than people, and they may not have all the benefits that people without disabilities have. So for many years, the FMLA and Family Leave Act of New Jersey provided protection so they didn't get fired, but they wouldn't get paid. And for them, if without getting paid, their financial situation struggles. So paid family leave has been wonderful for people with disabilities and their family caregivers as well. If a parent who has a child with disability suddenly has to take off all kinds of time to do the caregiving for that child. My sister had a baby who was born at 30 weeks, and she had to take off a ton of time because one, he was in the hospital for a long time. When he came home, he couldn't start preschool or he couldn't start daycare in a normal time because he was at such risk for other kinds of illnesses. So it became a problem for her to be able to take that time off. And you see this with all kinds of parents with children with disabilities. And you see it also with caregivers at any age. A person with a developmental disability, when they become an adult, they may not have as many options for day programs and things like that, and the parent has to take more time off. So it's been a really great thing for people with family members and people with disabilities to be able to get a job and to maintain a job. Thank you.
Thank you, Mary. Appreciate that. And now we'll wrap this question up with Donald Campbell.
Hi, everybody. My name is Donald Campbell. I'm the Executive Director of the Atlantic Center for Independent Living. We are the Center for Independent Living that serves Atlantic County. For those of you that don't know, Centers for Independent Living are non-residential, nonprofit, disability resource support and advocacy centers that exist nationwide. And they exist all across the state. So even if you're not in Atlantic County, there's a center that serves your area. We help people with different applications. We help people who need an advocate. We have peer support and activities to get people with disabilities involved in the community. So that is us in a nutshell. And like I said, if you're interested in what your center is in your area, just look up New Jersey Centers for Independent Living. It's important to say we're no cost, and also that we're run by and for people with disabilities. We're mandated to have 51% of our staff and board have a disability. I have cerebral palsy myself, and the history of Centers for Independent Living goes back to the Civil Rights Movement, and the Americans with Disabilities Act were very integral in getting those pieces of legislation passed. And I think where family leave ties into this is it's really about building on the promise of the ADA, which was to allow people with disabilities to be integrated into the community, but it's hard to be integrated in the community if you are not also given the supports you need to be in the community. So if you have a disability and need to take off of work temporarily, or if you have a family member with a disability, or if you have a disability and have a family member with a disability, it's not like, as was said earlier, all people with disabilities are in the need to be taken care of position. A lot of people with disabilities are the caretakers themselves. So having these supports is about what allows people with disabilities to be in the community and allow people with disabilities to maintain jobs and obtain jobs and go to school and be fully participatory in the community. So we need to continue to build on things like family leave so that is that safety net and support for people with disabilities to thrive. And as we know, if you live long enough, or you can receive a disability at any time. So these supports are, again, as was touched on before, about the universality of our collective needs. This is what allows not only people with disabilities to thrive, but our whole community and society to thrive as well.
Thank you, Donald. So we're gonna go back to Javier, starting us off with a second question. And we're really going to tap into your expertise at this point in the experience that you have around some of the work challenges for people with disabilities, in terms of them needing to take time off for themselves or for a loved one, and or their loved ones needing to take time off to provide support. So can you share any efforts or any experience around those challenges, and then efforts or solutions to address these challenges with our audience?
Sure, thank you. Well, first of all, I think probably the biggest challenge is one that people with disabilities or family members really place on themselves, and that is that it took so long to get this job as a disabled person, or it's so difficult to find a job. That we're often scared to ask, or even request time off to have sick leave or the time that we need, because we know how important it is to have a job. And even though the numbers have been ticking up under COVID, or because employers are having difficult time finding individuals, this is still an issue for us, right? So I think I've known a lot of people here for a long time, and I've been working as a person with a disability since I graduated from college. So, I've personally faced a lot of these issues, where in the beginning of my tenure, I was like, well, I really probably shouldn't ask for time, even if I need it, or I should take other time because I don't want to seem like, that person with a disability that's just trying to use up their time and not doing their work, which, as we heard earlier, is really a myth, because people with disabilities actually, show up to work more than the average person. They're more loyal employees. So it's a real issue, that we personally have to deal with. The other issue is, we don't want to be fired, of course. And we may think that that is a problem. And I think part of the solution may be to really work on the education of employers. I noticed this morning when we asked who was here, I don't think one person is an employer or listed themselves as an employer. And I think that's a problem, right? If we're all just talking to each other, that's great. We're educating each other. But if we don't have some of the people in the room who really need to know this, that's an issue. I think some other solutions around some of these problems would be to work with people with disabilities and organizations like Disability Rights New Jersey or other disability organizations in the state, and have them work in terms of educating people with disabilities so that they don't feel, uncomfortable asking for what's technically a right. This is not a privilege that the employer has to give us or not to give us this. This is our rights under the law, just like the Americans with Disabilities Act is our right under the law. I often talk to people with disabilities directly, and I think it's important to be honest with them and let them know this is what you have to do, and this is how you have to do it. So I think, in terms of the solution, I think those are some good solutions that we could use.
Excellent, Javier. And I know folks are taking notes and going to rely on that, those suggestions in the recording. Dr. Spitalnik.
Thank you. Well, I certainly agree with what Javier was saying. And I think one of the huge challenges we have is information that's accessible to people, for people with disabilities to know their rights and to know this is a benefit. And so I think particularly of the employment specialist training we do at the Boggs Center in terms of supporting people in getting jobs, have that part of that really needs to be understanding this. I think one of the things that, and I really appreciate what John said about that any of us can become disabled at any point in lifespan. And when that happens, it's really a crisis for an individual. And needing to have not only the information about your present situation, what you need to maintain yourself, but what your rights are, and being able to advocate for them, as Aaliyah and Janet were talking about. I want to highlight that for families of people with developmental disabilities that originate early in life, that there are tremendous numbers of continuous transitions. When you find out that your family member, your infant, your newborn has a disability, then you're dealing with one set of systems. And at best, maybe you get information about that system, but you don't really get the kind of information, the kind of social insurance that this is how you can maintain your family, whether it's visiting the NICU that Mary talked about. Then if you're going on to early intervention, special education, transition to adult life. And I think one of the things that those of us who work in service systems and education is to realize that a lot of services, particularly even those that foster participation in your own planning or your family members' planning, are organized around a professional schedule. So if there's a meeting for an individual educational plan, it's during the day, which requires a family member to take time off. If you're going to a physical therapy appointment, it's during the day. So not only is paid leave a benefit, but it's really compensating for the ways that we've organized social supports for all of us. I also want to mention as a challenge the digital divide and literacy in terms of access. You know, that was a wonderful presentation about how to access family leave in New Jersey, and we have a broad array of rights, but you need to be able to have Wi-Fi, you need to have computer, you need to be literate, you need to speak English in most cases. So I think we should be aware of that. And also the issue that I'll use the kind of jargony label of compound caregiving. Don spoke about being caregivers for your parents. And we know many people who are caring for either a child or a brother or sister with disabilities, as well as caring for aging parents. And all the systems that support people like that are separate. And so developing information, and I really see this as one place where the Boggs Center has a particularly critical role in preparing accessible information, linking people to information, and training medical students, physicians, social workers, caregiver, direct support workers about the benefits of family leave.
Excellent
Family
points,
leave.
Dr. Spitanek, excellent. Janet.
So as I was thinking about this, there are two real issues that impact a great deal the mental health side of this. And obviously the most glaring one is stigma, because people who have mental health challenges are going to be reluctant to put that out publicly. And so I do think like we're in a slightly different place. I think that was one of the maybe tiny silver linings of the COVID situation, was we all began to realize how fragile mental health is. And so there is a little bit more of I always like to say we're having a moment, you know, where people are kind of a little more aware and a little more willing to talk about it. And so normalizing those conversations more within the workplace, I think, can be really important, because it does help people then to be less like afraid and less concerned about being able to express their need to take paid leave because they need to care for themselves or someone in their family who is dealing with such an issue. I think it's also about recognizing that mental health and physical health are not two separate things, but they're all part of one's health. And so any kind of request that's being made to do that, there has to be parity. We have to understand that they're not different from one another. And it's not like as if because it's a mental health issue, somehow you ought to be able to take care of it differently than what you do if it's cancer or diabetes or whatever it might be. So I think, again, having those kinds of conversations. The other thing that struck me as we were talking was, you know, I feel like there are lots of employees, and I know this from my daughter who works in the corporate world, who really are trying to pay attention to this issue around disability and that. And so partnering with those employers to kind of look at what their best practices are and really bringing them to the table to be part of the conversation could be a really valuable thing, because I think that there is a real interest and concern and sensitivity among some employers. And so we need to leverage that, I think, for those who don't have that going on or happening. So those were some of the thoughts that I had. I think that flexibility and compassion are really key, because not everybody's the same. And so every family that is coping with a challenge around, you know, caring for someone who has a disability, or they themselves trying to cope, it's not like a one size fits all sort of situation. Like every situation is different. And so building the kinds of relationships and sort of helping people to recognize the importance of that flexibility and compassion in dealing with their employees and or peers and or whomever is really critical. So those were just some of the thoughts I had as we were talking about this.
Excellent. And the one, it's not one size fits all. And we see that just by this panel's presentation and the varied perspectives that are coming through here. I'm so intrigued and excited to hear those different perspectives because it helps trigger each of us to kind of challenge our thinking a little bit more. So Aaliyah, I'm happy to hear you now respond.
Thank you. So some challenges around work for members of the disabled community include a physical environment that's inaccessible or hard to navigate, negative attitudes within the work environment, and a lack of relevant systems, services, and policies for disabled employees. Specifically for people living with HIV, stigma, as Janet said, and discrimination remain a huge barrier to employment, especially in terms of job retention and progression. Having paid leave gives people living with HIV or any person with a disability a feeling of security. It's reassuring for them to know that if they get sick or need to seek medical attention, they'd still be able to support themselves and their family. While almost all people living with HIV stand to benefit from the adoption of inclusive paid leave policies, the newly diagnosed are among those who stand to gain the most. According to the World Health Organization, those newly diagnosed with HIV should start treatment immediately in order to stop the virus from weakening the immune system further. So early treatment allows people living with HIV to quickly get the virus under control, maintain good health, and prevent sexual transmission of HIV to a partner. Unfortunately, though, getting connected to care can often take several days or even weeks, which is why time off from work can mean lost wages, which only adds to the stress and anxiety of those newly diagnosed with HIV. So paid leave policies would reduce the economic and emotional burden of pursuing care and adds a sense of security for those seeking medical attention, time off to care for a loved one, and even if the loved one is disabled or themselves. And to quickly share some efforts that Garden State Equality is making in addressing these challenges. So we're working with legislators to hopefully get PrEP and PEP passed over the counter in New Jersey, which would make it more accessible and affordable for those seeking care, as well as partnering with HIV-specific organizations to conduct free rapid HIV testing for community members so that there isn't that added burden or stressor for those who may be uninsured or can't afford to go to the hospital to get tested or to take time off of work. So we're trying to make those efforts to make it more accessible from some members of the disabled community.
Thank you, Aaliyah. Very rich, very deep and profound. I appreciate that. And Mary.
Well, now a lot of people have already said what I was going to say. So like
that's okay. We're a little short on time. So if you just add to anything different.
Yeah, I think most of what I'm kind of reiterating what they say, but when I've seen over the years is the biggest barrier for employment is to access their rights is for employees they fear that if they access their rights, they're going to lose their job. They do fear about retaliation. I know the law says you can't retaliate against an employer for accessing these rights, but they have a true fear that that will happen. And that even if it does happen, how can they enforce their rights? They don't have the money to sue their employer. So there is a real problem there. And they say one of the biggest issues also is that with respect to hidden disabilities, people don't want to share their information. They don't want their employer to know their medical history. So there is that fear as well. So I think there's a lot of fear about accessing the rights and to try to figure out a way to make sure that people can, they know their rights and that they know that if they do access their rights, they won't be fired.
Great, Mary, thank you. And you're the organization and go help people access those rights. So appreciate that coming from you. And then Donald.
Hi, so I'll just add two quick things. A lot of it was already touched on, but one of the things I think that would make signing up for family leave easier and something that we can do to remove barriers is to look at things like applications and internet access. And when you call, does somebody answer the phone? I mean, those are little things that if you have a disability or a loved one with disability, if you don't get those answers or can't get online, or you get online but the website doesn't work or is not accessible, that just is a barrier, and that could completely turn you off from getting a program that you are otherwise eligible for. So sometimes I think when we have these discussions, we think about like the big things like passing this law or that law, which is all really important, but on a small scale, what we can do is just look at this process and say, is it easy? Is it accessible? And I know we have, I understand you're signing up for a government program. They have to check different things. I completely understand that. But are there little things we can do to make it easy to access? And on the bigger end, I would say, going back to employment, the biggest thing that I see that prevents people with disabilities from getting jobs and from maintaining jobs is fear of losing benefits. So if on the federal level, we can look at things that will make it easier for people with disabilities to save and make money. I know currently under Social Security and Medicaid, you can only save $2,000 if you're on SSI or Medicaid, and there are ABLE accounts for those of you that don't know that do help with savings, but not everybody knows about them, and they're not always the easiest to get. I just did a podcast interview with the outreach person at Division of Disability Services in New Jersey speaking about that, Christine Chigadow. So if anybody needs that resource, that's a great resource. But again, there's a lot of work to be done, both big and small, that we can do to give people with disabilities more supports so they can thrive in the community.
Thank you, Donald. You know, we're not going to have enough time to probably go through this last question completely. I know that the New Jersey Paid Leave Collaborative wants to continue this conversation, welcomes everyone to be part of the conversation. So for those of you who are viewing, this session today or get to view it at another time, please share with them your thoughts, your concerns. The more information they have, I think the more they can work with in order to raise awareness and help to advocate to solve some of these issues. So we're going to use this last question as sort of like a speed round. And we're going to have about a minute each. And if you could, because you're all so connected and you're all so wonderful, just give us and to give the collaborative some ideas as to how we can spread the word, how we can get more people knowledgeable about paid family leave, and how we can have questions be more evident, or have answers to questions be more evident. So what's your take, Javier?
Thank you. Well, I think I want to just briefly mention that when we're talking about communication access, we should also think about language access. Latinos in New Jersey make up almost 22% of the population, a huge portion of New Jersey's population. So that's important. And then, I know I said this, and Debbie and some other people said it, but, really work with the disability agencies like Debbie's agencies and, independent living centers like Donald. And of course, Mercedes has an amazing list and great resources. So I think that is hugely important. And I think you should start there.
Terrific. I like the speed round following there, Javier. Janet.
I was going to suggest maybe some social media campaigns. I realize that not everybody, is on social media and that, but I certainly think that just putting it out into the public through those platforms can be very useful. So clever, well done sort of social media campaigns could be an interesting option.
Excellent. Yes. Aaliyah. I'm sorry, Dr. Spitanik.
It all depends on where your box is on the screen.
Sorry, yes,
no apologies. So I always like things that give us the biggest bang for the buck. So what I'm thinking about, particularly in the Bog Center, but for all of us, is to have information about paid family leave, part of the transition process from for students in special education, the transition to adult life. And I think that gives us two things. It helps educate individuals with disabilities who are going to go into the workforce. It also educates families who, unfortunately, we're seeing at the time of transition to adulthood, often have more responsibilities because there's such limited employment. So that's one target that I would have for education, children and families, and the Division of Developmental Disabilities.
Thank you, Dr. Spitanik. And we'll try to go back in order. So Aaliyah.
I was going to say the same as Janet. Social media campaigns is a huge one. Garden State Equality also does a monthly newsletter, so I would love to put all of the information that was shared here today in our next one. So it'd be great to connect with, the panelists on that. We also do cultural competency trainings, as I said. So training employers on why it's important to offer paid leave, and also training employees on like know your right campaigns, and so that they're aware of, what is eligible for them. Even just going into communities, tabling at different events. There's just so many different, ways to spread awareness.
Excellent. Excellent. Thank you. Mary, your speed round.
Basically, like I was thinking some of the same things, but I would also say, I guess, collaborate with grassroots organizations that aren't necessarily disability related, because it can help with all across all people with this, even people without disabilities. Paid leave helps everybody. So work with other grassroots organizations to get down to where people are. And also maybe work with union groups and in their efforts, because unions are trying to improve or increase their they're trying to spread. So it may be something that we can work with them on as well.
Thank you, Mary. Donald.
Yes, and I'll be speedy too. A lot of it was already touched on, but I agree. Social media, working with different groups. It doesn't have to be a disability friendly group in terms of advertising that they work with people with disabilities. Your Centers for Independent Living, there's all kinds of wonderful groups that work with people with disabilities, but your Chamber of Commerce, and really emphasizing that this is actually a benefit to your employees as well, that if employees feel supported and secure, they're actually going to be better employees than if they feel like they can't work and take care of the responsibilities for themselves or their loved ones. So I would just have to take a very broad lens when looking at it. And also, if it's possible, put some money behind it, because social media is great, but there's ways to boost posts so it goes to a lot of people. There's organizations like Centers with newsletters, and like Garden State Equality with newsletters that have. I would love to put all this information in my newsletter as well to make it real quick for people to see. And my other one key point is just keep it simple for people, because sometimes when we're explaining this stuff, we assume that everybody else is in this world all the time, but just keeping the information as simple as possible so that people get an idea of what their rights are and what their supports are, I think helps it be more easier to share and comprehend.
Thanks, Donald. And I'm going to throw in just a personal perspective. Having spent 11 months in the critical care and rehab center with my own daughter who has disabilities, healthcare settings, I think it's important to bring information to healthcare settings, to hospital social workers, our medical settings, because that's where, I needed to learn about what was available to me as a single parent with a daughter with who had experienced a medical challenge. So I think we're a little bit over, but I will turn it back to Nat, I think. Thank you, Nat.
Yeah, I was actually going to transition back to our slides. Hi, everybody. Thank you first, Mercedes, for facilitating an amazing panel and all the panelists. That was fabulous. I have no words except just gratitude and appreciation. We are going to just kind of wrap up here with some final kind of pitches of what you can do, continue to be involved in our efforts. I work at New Jersey Citizen Action Education Fund, and we help convene the New Jersey Paid Leave Outreach Collaborative. We are a Department of Labor Care grantee, along with some other amazing organizations that are also funded by the Department of Labor as part of the expansion in 2019. Groups are actually receiving resources so that they can help get the word out. So we're really excited to be able to be these trusted messengers and collaborate, and everything that everyone said we want to do like right now. So help us do it. We need your support. Come to our quarterly convenings. We do hold these every quarter. Stay tuned for when the next one is and what the topic or intersection will be. We also hold train the trainer sessions that do a deeper dive. And for folks that maybe need a stipend to be able to take the time to attend those train the trainers, those are available as well. So we'll send around those dates and opportunities to get involved and get a little more deeper training as well. And then if you're interested in the advocacy efforts, as folks spoke about today, the New Jersey Time to Care Coalition has been working for years on this issue. And now we're looking at the issue around job protection and how complicated and limiting the job protection laws are. And that is going to be our key focus. And we would love to have everyone be a part of that because it is going to be a heavy lift. So stay tuned for more on that. This recording will be sent to everyone and along with some of the resources of some of the panelists and others that were mentioned today. So we'll make sure to get that out to everyone, as well as the Department of Labor website and contact information. This is the one flyer that we really recommend. If there's one piece of information that you use in your outreach, it would be this one. But we are also working on some toolkits, and I'll actually turn it over to Nat to share a little bit about that.
Yeah, so thanks, Yarrow, for all of that. And I just wanted to share with everyone our website and the toolkits that we are developing. So if you go to njplc.org and you go over to toolkits, you'll see that we have a group of them. And I'm actually this week, I'm going to be adding a disability rights toolkits, which is exciting. And when you press on one of the toolkits, it'll take you to the Time to Care website. And these are new and updated graphics that we have and some information, some videos. I'm actually going to put a link to be able to download these images too. So definitely check that out. And here's just kind of a preview into one of the toolkit images that we are creating. And I'm going to have this sent over in our follow-up email. And once I have that toolkit up on our website, we will also have that sent over. So just keep an eye out for that. And yeah, super excited and just a great way, especially, you know, throughout social media to just get information, you know, across to a wide range of perspectives. And, you know, obviously it's very much needed. So yeah, keep an eye out for that. And I really appreciate everyone for being here, all of the speakers and just everyone who helped make this happen today. This was an awesome convening. So thank you so much, everyone.